Okay, welcome back. This is Dr. Jin Sung, and welcome back to the Tuesday show. It's 12:30, and today we're going to talk about liver and liver dysfunction. We're going to go in detail and cover the broad aspects of liver detoxification and some of the symptoms that are associated with liver problems. Before I get into it, I'd like to also remind everyone that we do have the GI seminar this coming Thursday, the 14th. It'll be at 6 p.m. to 7 p.m. here right in this office. So if you want to sign up, please call the office at 978-688-6999, okay? So if you want to sign up for that seminar, we'd love to see you there. So today we're going to talk about liver. So if we have a liver problem, let's say, what are some of the symptoms that we might experience? The liver in itself is about 3.5 pounds, and it has over 500 different functions. So it has a great number of different functions, everything from immune functions, digestion, detoxification, protein synthesis, you name it. So when we talked about the GI stuff the last few weeks, the liver actually has an important part in that detoxification or digestion phases for the GI tract. So when we take a person from gut protocols and GI dysfunction protocols, we always transition them into a liver protocol because it's so crucial for their overall health. So some of the symptoms for liver issues, and usually the big ones are when you have yellow skin, or your eyes, the white portion of your eye becomes yellowish. And those people tend to have higher level of liver enzymes, basically AST, ALT, and GGTP. Those people have probably some more acute issues and that needs to be medically managed. However, when you have people with subtle symptoms of liver dysfunction, such as a coated tongue where it's kind of whitish, bad breath, red palms or the bottom of the feet. You also have itchiness, a lot of itchiness in your hands and feet, okay? The yellowness again in the eyes, dark circles under the eyes, liver spots or brown spots that develop, a lot of rashes. You can also have a foggy brain, mood disturbance. Another big one is recurrent headaches that kind of persist no matter what you do in terms of let's say physical medicine, chiropractic, etc. People also with liver issues tend to have more allergies, chemical sensitivities, chronic fatigue issues. So the liver plays a huge role in all this stuff because it has over 500 different functions. So the liver again is 3.5 pounds. It's the second largest organ in your body, next to the skin. The skin is the largest organ, and then the liver. And the liver is responsible for a lot of different things. But when we are discussing liver right now, we're going to talk about detoxification, right? So the world we live in is pretty toxic. You know, you have environmental pollutants, you have herbicides, pesticides in our food, you have GMOs, hybridized wheat. You have all these constant bombardment of toxins, right? Everything from plastics, water bottles, etc. Even though a lot of the BPA has been removed out of these plastics, there are other components of plastic that can be very harmful for you. So I would highly suggest using a glass water bottle or a glass container to carry your liquids, especially your hot ones, right? You don't want to carry hot coffee in those styrofoam cups with a plastic lid. Basically, you're saying, let me soak my system in plastic, right, when you drink that. So you want to be cautious of that. So when we look at all these symptoms, we have to detoxify it in our liver oftentimes. And there's other organs of detoxification. But if you take these chemicals and medications and heavy metals and all these things tend to be fat soluble. So when it gets into our system, it'll deposit into fatty tissue, right? Not just abdominal fat or fat under your arms or your legs, right? it actually deposits into nervous tissue because your nervous system, a vast majority is fatty tissue. So it can deposit into the nervous system. So that's why it causes things like brain fog and so forth, okay? And also can create inflammation if it's not detoxed out. You have things circulating in our system that needs to get out of our system, and then your immune system goes, hey, that shouldn't be here. Why am I having so many issues going on? Okay. So when you take a fat-soluble toxin, it needs to be detoxified or made more into a water-soluble component. So that's what phase 1 of liver detoxification will do. Obviously, you'll need a bunch of nutrients to take your fat-soluble toxins and then convert it into an intermediary portion. And then phase 2 will make sure it gets it into a water-soluble state, therefore it can be excreted out of our system. So when we look at liver detoxification, we consider phase 1, phase 2, where you make it completely water-soluble and get it out through our kidneys and our gut and through our blood and serum. Then we also have to look at gallbladder function, which we consider phase 3. So you have phase 1, phase 2, and phase 3 detoxification. And they're all nutrients that are important through each phase, right? Minerals, cruciferous vegetables. The 3 things I like, if you had to take 3, I guess, but there are a bunch. You need a bunch of different minerals and vitamins to get you through from the fat-soluble toxins all the way out into the water-soluble state, okay? But milk thistle is a great liver detoxifier. I also like turmeric, and I also like dandelion root, right? So when we do liver detoxifications in our office, we use a powdered protein along with multi-spectrum nutrients that are specifically designed for the phase 1, phase 2, and phase 3 detoxification. But some of the things that you can do at home in terms of liver detoxification is obviously, number 1, eliminate the environmental toxins, right? Eliminate those foods are highly pesticide usage, GMOs and herbicides. Things like dairy, conventional dairy and conventional meat has a lot of herbicides, pesticides, hormones. That all needs to be cleared from your diet. The second thing you can do is look at your medications. If you're on a lot of different medications, go back to your physician and ask, what is the minimal amount of medications that I can take to have the effect that we want? Because medications definitely make an impact on liver detoxification. And oftentimes, when you get the jaundice or the yellowness of your skin and your eyes, oftentimes it can be medication induced. So you need to definitely go back to your doctor and get that corrected or modulated. So the least amount of medication to have the most impact would be the great way to do things, right? The other thing we like is coffee enemas. So if you can get organic ground coffee, we use a company called Saw Wilson, which is a high quality coffee specifically made for coffee enemas. And it has high levels of palmitic acid. And then when you do these enemas, it goes right through the portal vein into the liver and has a boost of glutathione in there, which will help detoxification of the liver. So it's very important for the patients to sometimes do coffee enemas because it's one of the fastest ways to get right into that liver. Okay, so elimination of toxins, elimination of foods that create problems for you. Look at your medications, make sure they're good, and then think about doing maybe a coffee enema. Another thing you can do is a fast, or what we call a metabolic fast. This is something you should do with the supervision of your doctor or a functional medicine practitioner, because the metabolic fast will sometimes take 3 to 5 days of not eating anything other than a lemon lime juice that you can make, along with maybe some maple syrup or raw honey, And you can fuel your body through 3 to 5 days just on that type of concoction. However, if you have blood sugar issues and you have issues with highs and lows of sugar, you do need to be cautious and you do need to be supervised in order to do a metabolic fast. What a metabolic fast will basically do is it will basically give you a break from all the food that you take in and all the foods that are heavy laden with antibiotics and herbicides and pesticides, and gives your liver a break for 3 to 5 days. Gives it a break so the function can return to a certain extent. Oftentimes a lot of people will lose some weight on this. They usually lose a lot of water weight during this. So it's a concoction where you use lemon or lime juice. You take a gallon of water and you squeeze lemon and lime juice in there. And you need a little bit of sugar, so you can use a gray bee maple syrup or a raw honey. And you can use that and you just sip that throughout the day. You have to drink throughout the day so you can get enough sugar to function. But at one point or another, some people with blood sugar problems will run into some issues with fatigue and nauseousness, or they just don't feel well. So again, it has to be done with some supervision. You cannot just go ahead and do this on your own, okay? So in terms of helping yourself, you can go ahead and do, like I said, maybe a little milk thistle, turmeric, dandelion root. Eliminate the foods and triggers that create problems with the liver. Look at your medication list. Make sure it's appropriate for you, and you should go back to your physician to do that. You can do coffee enemas on your own. Look into it. There's plenty of information on coffee enemas. You can go online and look at all the research. Coffee enemas have been used in different types of cancer therapies and so forth. So it's a great way to detox the liver. And a metabolic fast. Metabolic fast, again, can be 3 to 5 days, but you do need to be supervised in certain fasts, in certain situations when you have blood sugar problems. You just can't go on a fast when you're hypoglycemic. So it's very important that you monitor that, okay? So next week we're going to go more in depth and really delve into what is phase 1, what kind of nutrients do we need, what is phase 2, what kind of nutrients do we need, what is phase 3, and how do we all put it together so we can actually do a program to detoxify the liver. Because it can have profound effects on a lot of these symptoms that, a lot of physicians will go, I'm not sure. You just have a lot of things, everything else seems normal. However, if your liver detoxification pathways are blocked or not working correctly, then you're going to have a buildup of toxins, right? So if you think about in wheels, you have phase 1, phase 2, phase 3. So if something comes in and phase 1 is working really fast here, but phase 2 is slow, you're going to have buildup in the middle, in between these two phases, right? And then this is working really fast, and then over here it's very slow, then it's going to create development of toxins, right? So we want to be able to get all the wheels churning so whatever toxins come in can be easily processed out through the liver. And the liver is a fantastic organ because, one, it does so many different functions, but two, even if you have 50% damage of your liver, it still can do a lot of the work as long as you do the right things. So the liver is an incredible organ that can be regenerative to a certain extent, but it can work on half its capacity and still give you what you need. And it's one of those organs you just can't ignore, because once the liver goes, you're going to need a liver transplant, not just, I can go on a dialysis machine for my kidneys. You just can't go on a machine that will do all the different functions of the liver. You do need to take care of it, otherwise you go into a liver transplant issue. And one thing I probably forgot was alcohol. People who drink 3, 4, 5 drinks a night and go, hey, that's not a problem for me, it's just wine. You may have some liver enzyme issues. So you do need to be very careful if you're drinking alcohol on a very regular basis, okay? So I'd like to thank everyone. Please follow our page and share it with other people. That way we can get the word out. If you have any questions, please list it below the video and we'll get to them as soon as we can. But we'll see you next week on the continuation of liver detoxification. All right? Have a great week.